I get patients every day who are not getting regular periods, and they come to me and they tell me that we want to plan pregnancy very quickly. And when I see the parameters, their parameters are very deranged. They are either having PCOD, hyperprolactinemia, hyperthyroidism, or hypothyroidism, and their periods are missed. Basically, they are having either a 60-day or 90-day cycle. And at such time, when the patient wants pregnancy, what we have to do is we have to artificially stimulate the ovaries so that it will produce eggs. But whenever we are artificially stimulating the ovary, that stimulus has to be continued even after when the patient gets pregnant. Also, when we are doing this, the chances of patient getting pregnant is less than a patient who would be having normal cycles and we are not stimulating anything artificially. This is what is occurring these days, and that is the reason these patients end up going up to IVF and still there is no success in pregnancy, and after IVF failure they then come back to Ayurveda. Then we start from the roots. From the roots means first we regularize their period cycle, first we regularize their ovarian cycle. The ovaries, which are just dependent on the hormonal medicines from outside, we stimulate that ovaries to produce that hormones internally from inside, so that the patient will get cycles naturally, which is independent of the tabs the patient is taking, and patients will develop the egg also naturally from their ovaries only without taking such external hormonal medicines, and that results to positive pregnancy tests even in patients who have done IVF and who have done IUI also and they have failed. So this is the big difference how Ayurveda medicines work in contrast to the other hormonal medicines, and this difference nowadays patients have started understanding and they themselves come to Ayurveda. And do share this with maximum people who are planning pregnancy so that they may not waste years after taking such hormonal medicines and suffering from the side effects and then coming to Ayurveda. Thank you so much for watching.